Buenos dias, Zamboanga. Welcome sa Kapihan na Zamboanga kung saan pag-uusapan natin ang pinakabagong COVID-19 update sa rehiyon. We are live via cable televisions at MCTV and E-Media, and we are live at PIA Western Mindanao Facebook page, One TV Philippines, and other partner agencies' Facebook pages. Ating kukumustahin ngayong araw ang sitwasyon ng ating COVID-19 cases sa buong rehiyon. Kasabay na rin ito ang update patungkol sa ating vaccination program. Kasama natin ngayon from Department of Health ang Regional Director, Dr. Joshua Brillantes. Magandang umaga, Doc. Welcome sa programa. Doc Josh, welcome po. Tungo tayo agad sa ating update, Doc. Good morning, Doc.
Good morning and Happy New Year to sa lahat. No? So, balik na naman tayo dito sa Kapihan, and we would like to thank PIA for their untiring support and sa pag-broadcast ng mga tamang informasyon, no, regarding sa COVID-19 situation in our region, and also sa mga partners natin sa mga radio and TV programs. Salamat din po, and sana may maganda tayong New Year in spite sa we are experiencing itong surge, no.
Yes, Doc. Siyempre, Doc, we would like to know the update po, no? Ngayong bagong taon po, Doc, kumustahin natin yung ating mga cases and yung ating vaccination program naman dito sa Region 9. Go ahead, Doc.
Okay. So punta muna tayo sa national data natin, no? Ang total case natin as of January 9, 2022, almost 3 million na tayo, nasa 2,965,000. And then yung active cases natin ay 128,114. And then mayroon na tayong 2.7 recoveries, no? And then ang deaths natin, though ikinakalungkot natin, no, na dumadami pa rin yung deaths natin, at saka ito ay nasa 52,000, no, more or less. And then going to the regional situation, no, ng COVID-19, as of January 7, mayroon tayong total cases of 49,718. So almost 50,000 na tayo. And then for the active cases, ito yung mga nasa TTMF or naka-home isolate or nasa hospital. Ito yung mayroon tayong 186 na mga active cases. And then for the recoveries, mayroon tayong 47,000. And then yung total deaths natin sa region ay umabot na ng 2,268. No? So, kung i-disintegrate natin sila or i-disaggregate natin sila for the three provinces and the two cities, Zamboanga City and Isabela City. So for Zamboanga del Norte, as of January 7, mayroon tayong active cases na 9 for Zamboanga del Norte. And then for Zamboanga del Sur, mayroon tayong 32. And then for Zamboanga Sibugay, mayroong 13. For Zamboanga City, no, still ang Zamboanga City ay may maraming cases pa rin tayo, 126 active cases. And then for Isabela City ay mayroon tayong 6. So kung as we are daily, kasi may araw-araw tinitingnan natin yung cases natin, especially na we are expecting for a surge. And yun nga ang we have a positive increase in our growth rate, no, in our daily growth rate. So meaning every day tumataas na rin yung mga kaso natin for Zamboanga Peninsula. So for our specimen processing, kung makita natin, no, na we have for Zamboanga del Norte, mayroong 28 in Zamboanga Sur, 44, Zamboanga Sibugay, 22, and Zamboanga City, 236. For Isabela, we have 6 and mayroong from Barn. So kung titingnan natin from December hanggang ngayon, parang mababa yung mga uh, testing natin, no? And kung titingnan natin yung positivity rate natin for the whole region, we are at 12.65%. So medyo mataas itong positivity rate natin dahil mababa din yung cases natin and then marami yung mga positive result, no? So kaya mataas yung positivity rate natin. And then for our total bed capacity, because TTMF, no, TTMF bed capacity and our utilization rate, ito ay importante especially in times na you are expecting for the surge. And sana we expect our local government units na sana na dagdagan na nila yung TTMF nila at saka still they are maintaining yung functionality ng TTMF. So for the whole region, as of January, no, first week of January, mayroon tayong a total of 2.6% utilization ng ating TTMF. Okay lang man ito because kung nakita natin sa previous data na mababa pa naman yung cases natin. And then for the hospital critical utilization rate, critical care, ito yung isang indicator na very important indicator kung saan kasi isa din ito sa indicator if we need to escalate our alert level, no, sa bawat area. So kung makita natin yung ICU beds, isolation beds, ward beds, and the utilization of mechanical ventilator, ito yung makina, no, na tumutulong na para makahinga pa yung pasyente natin. All of them are still at low risk, no? So meaning hindi pa tayo umabot ng 40% or 50% 50% sa ating utilization, and this is for the whole provinces. So so far lahat ng mga provinces, no, we are still at the low risk level. Kung makita nyo kung makita natin diyan sa graph, no, makita natin na lahat naman ay low risk. So going further, ito yung makikita natin kung if we are still at the low risk or anong level natin. So far sa ngayon, no, lahat ng ating mga hospitals, no, for public or private, we are still at the lowest risk as of now. So anong slide? Okay, so I think that's already the last slide of my presentation, and siguro diretso punta na rin tayo doon sa for our
Vaccination.
question and answer.
Okay. Thank you very much, Doc, sa ating update, no, on our COVID-19 cases and status rin sa buong Zamboanga Peninsula. Doc, we can see a relevant or significant decrease talaga sa ating mga cases from the previous months and weeks. And kumusta po, no, yung ating cases? Nakikita po ba natin, like you mentioned earlier, that we are expecting a surge dito sa Zamboanga Peninsula? And this is because of the new variant, which is the Omicron. Ano po ba itong variant na ito, Doc? Paano siya nade-differ or anong difference nito sa ibang mga variant natin ng COVID-19?
Okay, based dito sa ating mga data, no, and also doon sa mga scientific studies, na ginagawa ng ating mga scientists and as what we also observe even here in our area. Like for example, nakita natin yung Delta variant before nung nag-surge siya ay marami ang mga hospitals, no, mataas yung hospitalization rate niya at saka marami yung mga severe cases. Now, for this Omicron variant, this is still the same. This is our mutated, no, from COVID-19 virus. And ang tendency naman, no, ito yung significant na characteristic ng mga virus na pwede siya mag-mutate, especially kung if it will increase its capacity na to mutate, no, like kung tumataas yung mga cases, so as what happened in South Africa, and wherein this Omicron variant has been discovered. So ang kwan nitong Omicron variant is that ang sabi ng WHO, no, this is according to the WHO, that the transmissibility of this Omicron is really fast. No? So, mabilis siyang na makakahawa. And in fact, kung titingnan lang natin sa ngayon sa NCR, for the last kahapon, no, compared to the previous days, um, from 28,000, umakyat siya ng around 34,000 in a single day. No? So, mabilis talaga siya. And dahil sa mabilis siya nakaka-transmit, then meaning this can evade yung immune protection natin. That's why it is very important yung vaccination. So, ang as this virus, no, can infect numerous persons, then it has the opportunity again to mutate.
Mm-mm.
So dapat we have really to contain its transmission. Dapat ito yung babantayan natin so that this will not mutate.
Okay. Doc, meron na po ba tayong na-record dito sa Zamboanga Peninsula? Meron na ba tayong Omicron case?
So far, based sa genome testing natin na ginagawa, so far wala pa tayong Omicron case here in Zamboanga Peninsula.
Okay.
Wala pa.
Magandang balita po yan, Doc. But are we going to expect po ba na talagang papasok ito? And kung sakasakaling magka-surge rin tayo like what happened in NCR, handa po ba tayo, Doc? Especially ngayon, meron na rin tayong shortage ng some of our medicines na makakatulong rin, no, sa paggamot natin ng flu. So, paano po yun, Doc? Ready po ba tayo?
Isa sa dapat tatandaan natin, no, na itong Omicron variant is still the same coronavirus. So we already experienced dalawang surge dito sa Zamboanga Peninsula, and still the same preparation has been uh, instigated by the different health facilities and our local government units. So we will still be, in case na magkakasurge, no, number one is that our TTMF and our mga contact tracer and testing are still functional. Dapat functional ito kasi for those that needs na hindi na kailangan na ma-hospital, dapat TTMF lang sila kung hindi kaya ng home quarantine. And then, so that we can reduce also yung movement ng mga tao, then we will still be using and we will strengthen our telemedicine and teleconsultation services para hindi na lumalabas yung mga tao doon sa magpa-check up. And then, for mild cases, dapat naka-TTMF lang sila or nandoon sa bahay or mga asymptomatic kasi 93% no, based sa data ng NCR are all asymptomatic and mild. And
Mm.
then we have to again we already advised no yung mga hospitals natin to do yung accordion type of accommodation doon sa hospitals no na dapat they can expand the number of COVID beds and ICU facilities in case na kailangan in case kung kinakailangan ng mga may sakit na ma-ICU or kailangan nilang ma-hospital. And then for the supply of meds, since last year we still encourage our hospitals and our LGUs to stock up, to stock more, to stockpile drugs and medicines that will be used for this pandemic and also yung mga PPEs and then yung oxygen tanks nila no and I think most of our hospitals were able already to prepare for more oxygen in case na kailangan ng for the severe or mga critical cases. So we will what we have prepared before dapat yun pa rin and siguro dapat i-strengthen lang natin yung uh, and even yung health promotion natin and advocacy dapat i-strengthen natin yun and we will uh, siguro especially yung home care no kasi karamihan nito ay hindi na kailangan ng admission. So dapat sa kanilang bahay dapat alam na nila mag manage, especially yung mga mild cases.
Yes. I agree, Doc, no, na kahit na bumababa yung cases dito sa Zamboanga Peninsula, ay hindi pa rin tayo dapat maging kumpiyansa. So, patuloy pa rin yung pag-strengthen natin ng mga advocacies and of course, yung pagpapaalala natin ng ating mga health protocols. Doc, let's go to our vaccination program. Kumustahin po natin yung ating vaccination, no, dito sa Zamboanga Peninsula. Did we already achieve po ba yung ating herd immunity? And will this help po ba itong kung sakasakaling na-achieve na natin or at this status po ng ating vaccination ay makakatulong ba ito to prevent the surge of cases?
Okay, sa for the total vaccination coverage, no, for those that have received yung 2 doses or 1 dose of Janssen vaccine, we are still at 41%, no, almost 42 kasi 41.92%. So, itong coverage natin ay medyo bumaba siya because our target now is already 3.4 million. So, this is already the whole population of Zamboanga Peninsula and this includes 0 to 5 years old yung target natin. So, out of that 3.4 million, siguro na mayroon na tayong mga 1 million plus no na almost 1.5 million na nabigyan ng kumpleto na dosage of our vaccine. And importante ito especially this time no na kasama ito sa management natin for this COVID na vaccination is very important kaya nakita na no like sa NCR na mataas yung asymptomatic and mild cases because they are vaccinated and ang ang risk naman for those non-vaccinated at saka yung may comorbidities and those above 60 years old ay mataas pa rin with this Omicron especially if they are not vaccinated.
Thank you, Doc. Doc, meron po tayong just in question no, regarding po ito sa ating VaxCert. And meron po tayong mga concerns na yung iba ay hindi pa rin updated yung kanilang VaxCert data online. So paano po to, Doc? Marami-rami na po ba yung ating backlog? And I think we need also to clarify or emphasize sino po ba yung nag-update ng ating VaxCert PH?
Okay, for the VaxCert, ang DCIT no kasi they are the one nagkuan doon sa platform. But we encourage yung mga LGU kasi mayroon namang mga data managers sa LGU. Kasi especially for yung mga data, kaya nagka-backlog kasi may mga data na hindi kompleto. No? So that's why it's very important, especially during sa immunization or vaccination, na ma-review nila yung mga data na sinasubmit kasi kung kulang yung data, hindi talaga siya ina-accept ng uh, ng DICT na
Yes.
ano, yung data management. And yung VaxCert naman kaya it was informed na for those na especially kung kailangan sa mga borders or kailangan ginawa nilang kuan yung VaxCert, yung vaccination ID na muna ang gagamitin because it was announced also ng DICT na may mga backlogs pa rin, especially dahil doon sa mga incomplete na mga data na ina-upload.
Okay. So we'd like to clarify po, Doc, na the process is kung ano po yung nakalagay sa kanilang mga vaccination cards, it will be forwarded po sa DICT and the DICT manages yun po, yung ating VaxCert.
Yeah, and during sa vaccination, aside from the vaccine card, meron talagang parang registration form.
Mm-mm.
Dapat kumpleto yung pag-fill up doon or
Okay.
else i-deny yun or hindi yun ina-accept uh, ng
DICT.
BIMS. Yeah.
Okay. Thank you very much, Doc. One more question, Doc. In terms of our booster vaccination, ano po ba yung guidelines natin dito? Sino po ba yung, as of now, na pwede na pong magpa-booster shot for COVID-19 vaccines?
Okay, so for the booster shot, no, and in fact, the government has come up with may guidelines ito na it will be an open door kung sino yung pwede na ma-booster, dapat magpa-booster na, and especially with the threat of this Omicron, dapat yung qualified na no na magpa-booster, dapat magpa-booster na. So before it was kailangan na 6 months interval, but sa ngayon kailangan na lang is 3 months for the two doses vaccine. But for Janssen, no, which is the Johnson and Johnson, 2 months lang ang kailangan na pagitan before we can provide the booster shots. So, mayroon tayong tinatawag na homologous and we also have the heterologous. Homo, kung isang klase lang no na vaccine, like yung first 2 doses mo ay Sinovac and then magpa-booster dose ka ng Sinovac din, that is homologous. But for Sinovac, like for Sinovac, ang pwede natin na booster dose for Sinovac ay Pfizer, AstraZeneca, and Moderna. And then for AstraZeneca vaccine naman, kung yung 2 doses mo ay AstraZeneca, you can only have Pfizer and Moderna. No? And then for the rest, siguro, hindi ko na lang ito isa-isahin dito, but all our local vaccination centers or vaccination sites, alam naman nila itong mga combination kung ano ang ibibigay for booster doses.
Okay. So clarify ko lang, Doc, anyone po ba na 3 months na po or may interval na of 3 months after their second dose ay qualified na for the booster?
Yeah, yes. Ang importante lang is they have to coordinate also with the localities, especially kung baka may meron silang mga special schedules. Kasi itong mga vaccines, no, like for example, yung Pfizer, yung Moderna, dapat kailangan may certain number of vaccinees na dapat bigyan kasi hindi masayang yung sobra na vaccine in case na mag-open sila sa vaccine.
Okay. Thank you very much, Doc. Doc, one last na lamang po. Ano po yung ating mensahe sa ating mga viewers? And paalala po natin sa kanila.
Okay, so again to our viewers, I hope we can have a happy and merry New Year. And as we are again threatened with this Omicron variant, and wala namang pagkakaiba yung prevention na gagawin natin dito. No, so we have number one is that kasi itong katawan natin ang inaatake ng virus. So dapat we have to strengthen our immune system within our body kasi kung ito ay mahina, ito ay madaling ma, we are at risk no sa mga complication uh, ng virus na ito. So dapat mayroon tayong magandang dapat matulog ng 7 to 8 hours kung pwede sa gabi, and then mag-exercise, and then dapat gulay, and then dapat maganda yung diet natin, and then we have to reduce or we have to stop na no yung paninigarilyo, at saka dapat pati yung pag-iinom no dapat we have to make sure na yung katawan natin ay malusog. And then second is importante sa atin ngayon, especially na mayroon na tayong vaccine, and nakita naman no na it is proven na if one is vaccinated, it will prevent and it will prevent one no from hospitalized or magiging critical and even death. So we have also learned for the last 2 years, especially yung minimum public health standard natin no na paggamit ng mask, paghugas, and then distancing, and then dapat in case na sa mga offices kung hindi ma-maintain yung distancing, dapat mayroon tayong arrangement ng work schedules para maiwasan natin yung yung pagdikit-dikit no, especially sa mga offices. And then make sure na yung office natin or yung kung saan tayo pupunta ay maganda yung airflow, and isa sa pinaka-importante is vaccination, vaccination, vaccination. So dapat for those na kasi as of now mayroon pa tayong around 1.4 million people here in Zamboanga na hindi pa naka-receive ng first dose. So we encourage everyone with the help of our local government units, our partners, na dapat i-advocate pa rin natin itong vaccination. Especially doon sa mga A2, no? Yung mga senior citizens natin, at saka yung may mga comorbidities na dapat dapat sila ay 100% vaccinated, and if they are already qualified for the booster shot or booster dose, magpapa-booster na rin tayo. So again, let us all be reminded, yung mask, hugas, iwas, airflow, and vaccination. So again, in behalf of our regional office or the DOH, Department of Health Center for Health Development, we would like to congratulate and would like to thank Kapihan, uh, the teams of PIA headed by Director Noemi, and to the rest, and also to our media partners for helping us and for assisting us and as our partners in providing this information. So let us all be safe, and let us all pray na sana we will not be experiencing those that have been experienced in other areas na mataas yung namamatay, mataas yung mga cases. So I think that's all for us, and thank you very much once again, and God bless us all.
Thank you very much po. Once again, Dr. Joshua Brillantes, the Regional Director of Department of Health Region 9. Maraming salamat, Doc. At yun po, sundin natin yung payo ni Doc upang maiwasan natin yung pagkalat pa ng COVID-19 and of course, upang maiwasan na rin talaga yung ating bagong variant dito sa Zamboanga Peninsula. Maraming salamat po sa update at muli po pinapaalalahanan po natin ang lahat na magpabakuna